Good morning to all the students who are been there. So today we are going to discuss about the last part of your chapter 5, digestion and absorption. So in this class we are going to discuss about the absorption, assimilation and ejection of your digested food. Okay. Under the assimilation, under the absorption and assimilation, we are going to discuss about how the carbohydrate, proteins and fats are being absorbed and get assimilated in the cell, and finally the ejection process we are going to discuss. And then we are going to discuss about calorific value of this carbohydrate, protein and fat. And apart from this, we are going to discuss about the nutritional and digestive disorders. Okay. So yesterday we have discussed about the digestion of the carbohydrate, proteins and fat, and the final digested product you are able to get it here. When the carbohydrate is digested, the final digested product is glucose and galactose. Similarly, when a protein get completely digested in small intestine, you are able to get amino acids. So similarly, when nucleotides or nucleosides are get digested, the final product you are able to get the nitrogenous base. And then fats are been digested and produces fatty acid and glycerol. Okay. So now, how these the final end product of your digestion, how this final end product of your digestion get absorbed from the intestine, and how it is being utilized for the production of energy. That is what we are going to discuss today. So these are the final end products of your carbohydrate, protein and lipids. Okay, these are the simpler substances. These simpler substances that is formed in the duodenum and jejunum, and it has to be absorbed. Okay, how these substances are being absorbed, that is what we are going to discuss. When you come to this absorption, what is absorption? It is a process by which the end product of your digestion, that is amino acid, glucose, fatty acid, they are the end products of your digestion. This end product of your digestion is been get absorbed from the intestinal mucosa into the blood and lymph. So it is called as a absorption. Okay. So in your small intestine, especially in the ileum part of your small intestine, you have a long finger-like projections called villi, and in that villi, in the center part of your villi, you will be having the lacteal duct, and it is been surrounded by a capillary network of capillaries. Okay. So that is the main important thing, because only through this lacteal duct, the lipids, especially the fatty acid and glycerols, are being get absorbed, whereas the other fine network of blood capillaries are been available for the absorption of the amino acid and the glucose. So amino acid and glucose are being directly absorbed by the fine network of blood capillaries, whereas lipids cannot be absorbed, and it can be absorbed only by means of this lacteal duct. Okay. So where this lacteal duct is present? It is present in the villi of your lumen of ileum. Okay, next. So the process of absorption is mainly includes three important steps. The process of absorption, it mainly includes three important steps. What are all they? They are active transport, passive transport and facilitated transport. So these are the three important process that is involved in the absorption of your food. First we will see about what is the food that is absorbed by passive transport. Only 30% of small amount of glucose, 30% of glucose or small amount of glucose, amino acid and electrolytes like chloride ions are only absorbed by the simple passive diffusion. Okay. So the remaining 70% of your amino acids, proteins, especially amino acids in the form of proteins, glucose, they are all been absorbed, sodium, they are all been absorbed only by the active transport. Only 30% is been absorbed only by the simple passive diffusion. So you know what is simple passive diffusion? So movement of molecules from higher concentration to lower concentration. Okay, that is the way by which these glucose, amino acids and electrolytes are been first it has been transferred passively, and then the remaining 70% of your amino acid, glucose and sodium are transported only by active transport. So what is active transport mechanism? It is transported only with the presence of the energy in the form of ATP. That is called as active transport. ATP is utilized. Energy is utilized for the transport of the substances by active transport. Okay. So here in active transport, the molecules are able to move against the concentration gradient, that is from lower to higher. So then few molecules like disaccharides like fructose, they are usually being carried out only by facilitated diffusion. So among these three diffusions, active, passive and facilitated diffusions, we are able to discuss, we have discussed what are the various end products of a digestions get transported. Next, when you come to these insoluble substances like fatty acids and glycerol and fat soluble vitamins. Okay, so some insoluble substances like fatty acid, glycerol and fat soluble vitamins, they are not been directly absorbed by the fine network of capillaries that is present in the villi. So how these fatty acids and glycerols and are been absorbed? First, they are able to form a fine spherical small water droplets. Spherical small soluble water droplets are being formed, and these fatty acid, glycerol and fat soluble vitamins are incorporated into that particular soluble droplets, and then this we call these soluble droplets are micelles. Okay, so these micelles are then absorbed in the intestinal mucosa where they are being resynthesized. Okay, first these molecules, fatty acids and glycerols are being incorporated into the micelles, and these micelles are being transported or absorbed into the intestinal mucosa where a protein coat will be synthesized, and we call this as protein coated fat globules. And these protein coated fat globules are called as what is that? Chylomicrons. Okay, these chylomicrons are now transported into the lacteals of your villi. From the lacteals, these fatty acid as well as these glycerol are transported into the lacteal duct, and from the lacteal duct, these chylomicrons are being transported to the blood. So from the blood, it is transported to the liver, and in the liver, this blood which is having these fatty acid nutrients will be completely scrutinized, and if any toxic substances are present, that are being removed, and finally the blood from the liver is transported to the heart, and from the heart this what is that, purified blood that is having this fatty acid and glycerol and the fat soluble vitamins are transported to all parts of your body. So in this way, your nutrients like carbohydrate, proteins and lipids are all being transported from your small intestinal lumen into the different parts of your body. That is especially to the blood as well as in the lymph. Okay, you can see here monosaccharides are transported directly into the blood. Amino acids are transported directly into the blood. Whereas if you take the fatty acid and glycerol, they are first converted into micelles and then chylomicrons, and then finally it is transported to the lymph. Okay, so this process is called as a absorption. Okay, transport of the digested end product into the bloodstream and the lymph is called as a absorption. Next we will discuss about assimilation. What is meant by assimilation? So assimilation is a process by which your end products like this end products which is present in the blood as well as in the lymph, they are being taken up. They are being taken up by your cells. Okay, for its various cellular activities, as well as it is these end products are being incorporated into the protoplasm of your cell. So the uptake and the incorporation of this particular end product of your digestion into the cell is called as a assimilation. Okay, these incorporated end products like amino acid, fatty acid and glucose are used for various activities in the cell. Okay, this process is called as a assimilation. Okay, so the final end of your digestion topic is ejection. So what is meant by ejection? So the undigested food, the undigested and unabsorbed food present in the small intestine are able to pass through the large intestine. Okay, so this undigested and unabsorbed food which is present in the ileum will be having more amount of fiber, and we call this as a roughage. Okay, this roughage is a good nutrient for symbiotic bacteria. So the symbiotic bacteria will try to utilize this roughage and break down this roughage and produces vitamin K, as well as some more amount of other metabolites. These vitamin K and other metabolites are now absorbed by our large intestine. Okay, so once the food is been absorbed from the small intestine, the undigested food and unabsorbed food are able to pass through from the small intestine to the large intestine. And this large intestine, you have more amount of this fiber, that is roughage. So this roughage will be taken up by bacteria and produces some useful substances like vitamin K and metabolites. These substances are been absorbed along with your water in the intestine. Okay, so when you come to this absorption process, mainly absorption takes place from the mouth. Absorption can also take place from the stomach, small intestine and large intestine. So mainly the absorption of the main more amount of nutrients are being absorbed only from the small intestines. In the mouth, mainly some drugs and the simple sugars are absorbed, whereas in case of stomach, some medicinal, some of the important medicines like tablets which have been taken up or been absorbed from your stomach. Okay, but main absorption of your digested food takes place from the small intestine. Okay. Finally, when the large, what will be the absorption takes place from large intestine? The large intestine, mainly water and electrolytes can be absorbed. So during this time, these vitamin K which is been digested from this roughage will also be absorbed from the large intestine. Next, now once the water will be absorbed from this digested roughage, then the remaining leftover part is called as the waste part, and this waste part now move from the large intestine into the rectum, and where it will be get solidified, and we call this solidified form of your waste as fecal matter. Okay, so once the liquid is been absorbed from the large intestine, the remaining undigested part will be passed through the rectum and it becomes solidified in the rectum, and we call this solidified form of your waste as fecal matter. And these fecal matter are now will temporarily stored in the rectum, and because of this temporary storage of fecal matter, it usually initiates a neural reflex. So a neural reflex will be initiated and it creates a sense of urge for the removal of this fecal matter. So as a result, what will happen? The nerves will be stimulating this your body systems to remove this fecal matter from your body. As a result, the ejection of this fecus through the anus or through anal opening is called as a defecation. Okay, so this ejection process of your fecus from your rectum is a voluntary process, and it is usually carried out by a peristaltic movement. So what is ejection? It is a removal of this fecal matter from the rectum through anus. Okay, it's called as ejection. It is a voluntary process. Once the fecal matter is able to enter into the rectum, a reflex action is initiated. That is a involuntary process. So now we will discuss about the calorific value of carbohydrate, proteins and fat. So what is meant by calorific value? It is a value of heat that is being produced after the combustion of the carbohydrate, protein or fat. When a carbohydrate, protein or fat get combust, when it is able to undergo combustion, how much amount of heat is produced? Okay, that is called as a calorific value. Normally, when you are able to burn carbohydrate, you are able to get 4.1 kilocalorie per gram. That is the calorific value of your carbohydrate. When you come to the calorific value of your lipids, it is usually able to produce 9.45 kilocalorie per gram lipid. When you come to the proteins, they are able to produce 5.65 kilocalorie per gram. So basically, lipids are able to produce more high calorific value than the carbohydrate, right? So that's all about this calorific value. You no need to understand more than this. Basically, 50% of energy only is being produced by carbohydrate, 35% of energy is produced from fat, and only 50% you are able to get energy from the proteins. Okay, and then how much amount of proteins, carbohydrate and fats you are supposed to take per day? Per day you have to take only about 60 to 70 gram of fat, maybe 65 to 75 gram of proteins per day, and 400 to 500 ml of 500 gram of carbohydrate per day. This is the daily requirement of your nutritions. Okay. Now we will discuss about what is meant by the nutritional and digestive disorders. So what is meant by nutritional What is meant by nutritional disorder? As the name indicates, if you are not able to take proper nutrition, if you are not able to take proper nutrition, then it results in a disorder, and it is called as a nutritional disorder. So the first nutritional disorder what you have discussed, what they are discussed in your book is protein energy malnutrition. In short form, they call it as PEM. That is called as a protein energy malnutrition. Okay, now, so this disease is characteristics by the formation of stunted growth. Okay, so basically growing children's, mainly the children's are able to grow at the younger age, no. So growing children's usually require more amount of the balanced diet, especially proteins, carbohydrates. Okay, but if the children is not having able to take proper intake of this protein, and they are deficient in protein, so because of this protein deficient diet during the early stage of the children, it may leads to protein energy malnutrition, or it leads to a protein malnutrition, and we call this process as marasmus. We call this process as marasmus and Kwashiorkor. Okay, so marasmus and Kwashiorkor. This is the two diseases that occur because of protein energy malnutrition, and especially this marasmus is an acute form of protein malnutrition, and it usually occurs if your diet is not having proper amount of, or if the diet is having very low or no amount of carbohydrate and protein. Because of inadequate amount of carbohydrate and protein, we are able to get marasmus. So what are the symptoms of this marasmus and Kwashiorkor? You will be having a pot belly, you will be having edema in your hand, especially in the leg and face. You will have a stunted growth, because growth is required for, protein is required for growth. If you are not taking proper protein, you will be having stunted growth. You will have changes in the hair color, and since you are not taking even carbohydrates, you will become very weak and irritability. Okay, so basically the children with such type of marasmus and Kwashiorkor, they usually suffer from diarrhea, and they have become very lean and weak. Okay, if they are very weak, they call it as a emaciated, and they have a reduced fat and muscle tissue with a thin and folded skin. So these are the symptoms of your marasmus and Kwashiorkor. So only one diseases, that is nutritional disorders, they have discussed. So now from next to that, we are going to discuss about what are the intestinal or digestive disorders. The first digestive disorders, okay, is indigestion. So it's the first digestive disorder. How are you able to get this indigestion? How are you able to get this disease indigestion? If you are able to, if your food is not been properly digested, it results in this disease condition, indigestion. And why this food is not been able to digest properly? Because the digestive enzymes are not been secreted properly. That is inadequate secretion of these digestive enzymes, or sometimes anxiety. What is meant by anxiety? If you are being keep on fearing for a very, if nature of your, if physiologically if you are able to fear for everything, then it is called as anxiety. Or if you are worrying, okay, fear and worry, all those things will be generally called as anxiety. And because of this, what will happen? It will affect the digestion of your intaken food. And then sometimes the food is get poisoned, okay, or overeating. So all these and spicy foods, all these are the important causes of your indigestion. So how to avoid this one? You have to take, you should take a proper food that is not having any poison one. And then you should not be feel for, you should not worry too much. You have to reduce your anxiety, and you have to eat a normal amount of food, and then so that you may able to get a proper secretion of your digestive enzymes. The next important disease is constipation. This is another important diseases. Here, the fecus which is retained in the rectum will not be very easily released from your anus. And it usually occurs because of irregular bowel movement. Okay, because of irregular bowel movement, you are able to get constipation. Okay, why it is usually happening, this constipation? If your food is not having sufficient amount of fiber, okay, your diet is not having sufficient amount of fiber, and then if you are not able to do, after you intake your food, you simply sleeping and you are not able to go any, you are not able to do any physical activities. This may lead to this condition, disease condition, constipation. So in order to avoid this disease, you have to take more amount of fiber rich food along with your diet, and you have to do some physical activities like walking and stretching and all those things. So we can able to overcome this constipation. The third disease is vomiting. So this disease, vomiting, usually occurs when you are able to take a food that is having harmful and contaminated food substances. When you are able to take harmful and contaminated food substances, these substances will not be accepted by your intestinal tract, especially from the stomach. So your stomach will start ejecting these contaminated and harmful substances from your stomach. Okay, so this contaminated food now will be moving from your mouth. It will be moving from your stomach through your mouth. That is called as vomiting. So it usually occur because of reverse peristalsis movement. Because of reverse peristalsis. Normal peristalsis movement, it will allow the food to travel from the esophagus into the stomach. When it is able to undergo reverse peristalsis movement, the contaminated and poisoned harmful food will be able to push away from the stomach through the esophagus into their mouth. So it results in the condition called vomiting. Before vomiting, you will feel the sensation of vomiting. That is called as a nausea. The feeling of sensation of vomiting is called as a nausea, and then it is immediately followed by vomiting. So next important intestinal disorders, digestive disorder is jaundice. So jaundice is another important disease that is usually occur once your liver is been mainly affected. Okay, because of a defective liver or defective liver failure, you may able to get a disease called jaundice. How the liver is being correlated with the jaundice? Normally, liver will try to remove the bile pigments from the RBC, from the dead RBCs, from your blood. Okay, if your liver is not able to perform properly, if it is liver fails to perform properly, these bile salts will not be removed from your dead RBCs from your blood. As a result, these biles will be accumulated in the blood, and it results in the yellowishing of your eye and your skin. When a skin and your eye is being yellowed, we call this condition as jaundice, and it usually occurs because of the liver failure. The next one is liver cirrhosis. Sometimes mainly how this before going to cirrhosis, how this liver will get failed when you are able to have a high consumption of alcohol and all those things may also cause a failure of liver. Sometimes because of viral infections like hepatitis viral infections, you may able to get damage to the liver. In any cases, they results in a condition called jaundice. Next we will come to the liver cirrhosis. Cirrhosis means what? It is a death of the cells. So here liver cirrhosis is basically a chronic diseases of liver. It is a chronic disease. It is not an acute disease. It is a very chronic disease, serious disease that usually occurs only because of the degeneration and destruction of liver cells. So there will be a degeneration. That means what? The cells, the liver cells which is already present will not able to undergo regeneration. It will undergo degeneration. It will be just dying it, and it will be get destroyed. So finally what they are trying to say here is there will be a damage to the liver cells. As a result of this damage, it results in a condition called liver cirrhosis, and this may have the fibrosis in the liver. This is liver cirrhosis. Finally what will happen? The abnormal blood vessel and bile duct will be present, and it may leads to liver fibrosis. We can call this liver fibrosis as a scarred liver, and because of this it may able to form a disease called a liver cirrhosis. So this is usually occurred because of infection. What is the cause of this liver cirrhosis? It may be because of microbial infections or consumption of poison, alcohol and malnutrition. If you are not able to take proper food, or you are able to consume more amount of alcohol, or you are able to consume any poisons or any microbial infections, they all be the causes for your liver cirrhosis. So try to avoid consumption of more amount of alcohol, because your liver cells will be get damaged, and it leads to a condition called liver cirrhosis. Next is a gallstone. This is another important disease called a gallstone. As the name indicates, stone will be formed in the gallbladder. So it is called as a gallstone. What type of stones are formed? Mainly the stones are formed by means of crystallized cholesterol. Crystallized cholesterols are able to form a stone in the gallbladder, and we call this as a gallstone. Okay. how these gallstones are usually been formed? It is because of some metabolic disorders. Okay, so these formation of gallstones in the gallbladder, it mainly what will happen mainly how these gallstones are formed because of disorders in the metabolism or the alteration in the composition of bile. If there is any alteration in the composition of bile, normally bile will have bile salts, bile pigment, cholesterol and mainly these three important things. If there is any alteration in this particular composition of your bile, it may result in a condition called gallstones. Okay, how to avoid this? So what will happen if your stone has been formed in the gallstones? So he will try to obstruct or block the bile, the duct of your gallbladder. It will block the duct of the liver, or it will block the duct of both this hepatopancreatic duct. Okay, once these ducts are being get blocked because of this stone, then it leads to pain in the abdominal region, and it mainly causes jaundice and pancreatitis. It may also causes inflammation in pancreas, and it is called as a pancreatitis. Okay, fine. This is about your gallbladder. Pancreatitis. The name, how to pronounce it is a pancreatitis. Okay, that is inflammation in the pancreas, called as a pancreatitis. So next is a appendicitis. What is my appendicitis? You know what is appendix? You know what is my appendix? It is a region, a small finger-like projections that is present in between the large intestine and the small intestine. If we are able to get any inflammation in the appendix, it is called as a appendicitis. Okay, so once you are able to get this disease, appendicitis, you will be having a severe abdominal pain. How to overcome this? What is the main treatment of this appendicitis? Mainly, you have to remove this appendicitis. You have to remove the appendix by normal surgery method. Okay, you have to, as soon as you are able to get abdominal pain, you have to check for appendicitis, because this appendicitis, the abdominal pain is mainly caused only because of this appendix inflammation. So as early as possible, if you are removing this appendix, so it won't be any problem for you. A delay in the removal of this appendix by means of surgery may cause a rupture of this appendix, and it results in the inflammation. It results in the cause of infection in the abdominal region, and it is called as a peritonitis. Okay, so when your appendix you are able to get appendicitis and you are not able to remove that one, then what will happen? It will burst and it will be able to give more pain in the abdominal region, and finally you may able to get an infection called a peritonitis. So as soon as you are able to have this problem, you have to remove this appendix by means of surgery. So next is the hiatus hernia. So another important disease called as a hiatus hernia. It is otherwise called as a diaphragmatic hernia. Okay, hiatus hernia or diaphragmatic hernia. What is meant by this hiatus hernia or diaphragmatic hernia? So normally your stomach not protrudes. The content of your stomach, the superior content of your stomach protrudes slightly above the diaphragm. So you will be having a diaphragm that is lying next to the lungs, and next to the diaphragm you will be having a left side, you will be having a stomach, and the superior part of your stomach slightly protrudes into the diaphragm. So we call these conditions as hernia, and we call this condition as hiatus hernia. So what is the exact cause of hernia? We may not been still not been identified, but they came to the conclusion that when you are able to give more amount of stress to these muscles in the abdomen, though as a result what will happen? Because of more stress to these abdominal muscles, so this pressure in the abdominal region, it will pushes the anterior content or the superior content of your stomach into the diaphragm, and it results in a condition called a hiatus hernia. Okay, and mainly how you are able to give more pressure to these muscles in this abdominal region? By means of coughing, vomiting, straining during bowel movement, and lifting heavy objects. When you are able to lift heavy objects, or you are able to cough with a vigorous cough, vigorous vomiting, or sometimes a heavy strain of exercise, or you are straining when you are able to go for ejection of your fecus, if you give more strain and all those things, all these conditions are mainly responsible for the formation of this hiatus hernia. So try to avoid lifting more weight when your age get old. Okay, you can lift many more objects, heavy objects when you are in very younger age, but as the age progresses, when you are able to get older, try to avoid the lifting heavy objects and try to do aerobic exercises, so that you can able to prevent avoid more pressure that can be given to the abdominal muscles, and in turn you can able to avoid this hiatus hernia. So as a name, as we already discussed, this stomach content able to stomach content travel back to esophagus or even into oral cavity and causes a pain in the center of your chest. You see, this is stomach content and it is able to move into the esophagus region, and we call these conditions as hernia. You know already that stomach is able to produce more amount of acid. Okay, when you are able to get hernia, because of this corroding nature of acid, since this content is able to move through your chest region, you may able to feel some sort of pain. Okay, some sort of unwanted, unpleasant pain may able to get in your chest region, because stomach is been here and it is able to move near your esophagus, which is present which is usually present in the thorax region. You may able to get some amount of pain in your chest region, and it clearly indicates that you may able to have some sort of disease that is prone to hernia. Next we will discuss about another disease called as diarrhea. So diarrhea is a disease that is usually gastrointestinal disorder. Diarrhea is basically a most common gastrointestinal disorder in India, and it usually caused by the intake of the contaminated food and water. If you are able to take contaminated food and water, you may able to get diarrhea. Okay, so once you are able to take this food, what will happen? These food usually having this bacteria and viruses, it will enter into the large intestine, colon region, and it will try to damage the mucus that is lining the intestinal of your large intestine. It will try to damage the mucus that is lining the large intestine. As a result, what will happen? The large intestine cannot able to absorb the fluid, absorb the water that is been intaken by us. So the large intestinal colon, the colon of your large intestine fails to absorb or reabsorb the water in the large intestine. As a result, what will happen? The more amount of fluid will not be absorbed. It will be released from your intestine, and this high amount of discharge of this liquid through your intestine, through your anus, from your intestine through your anus is called as a diarrhea. So increased liquidity of fecal discharge is called as a diarrhea. Okay, so this usually occurs because of abnormal frequency of bowel movement. So when you are able to get infection in the colon region, it causes abnormal frequency of bowel movement and increased liquidity of fecal discharge, and we call this condition as diarrhea. Your bowel movement will not be normal. Okay, it will not be, the frequency of your bowel movement will not be normal, it will be having an abnormal frequency of bowel movement. So you will keep on going for release of your fecal discharge. Okay, and you will be having more amount of water in that fecal discharge, and we call these conditions as diarrhea. If you are not able to treat these diarrheal conditions, what will happen? Your body is mainly made up of water. So finally it results in a condition called a dehydration. You will become faint because more amount of water has been moved from your body. You will become dehydrated and then you will become faint. Okay, because most of 90% of your body is mainly made up of water. So immediately what you have to do? Once you are able to get diarrhea, you have to go for treatment of this diarrhea. What is the treatment you are supposed to do? You have to take oral hydration therapy. In short form they call it as OHT. Okay, you have to take oral hydration therapy. So oral means mouth, hydration means water. So you have to consume more amount of water with the water that is substandard or dissolved with more minerals. You have to take more amount of water that is dissolved with the minerals, and you have to take it orally in order to compensate the more loss of water from your the diarrhea. Okay, so this is the main treatment for your diarrhea. Okay. Next important disease is called as a peptic ulcer. What is peptic ulcer? It is a death of tissues or the erodal area of tissues that is lining the mucus of your stomach as well as the duodenum. So the tissue that is lining the stomach and the duodenum, if you are able to get eroded, or it has been completely, it has been removed, no, we call these conditions as peptic ulcer. Okay, normally this usually occur in the stomach as part as well as in the duodenal part of your intestinal tract. Okay, so mainly this ulcer are usually seen in the age group from 25 to 45 years. Okay, so when you are able to get ulcer in the stomach, it is called as a gastric ulcer, and it is usually common at the age of 50 years age. Okay, in case of duodenum ulcer, they generally name it as a duodenum ulcer only. But when you are able to get ulcer in the stomach, it is called as a gastric ulcer. Okay, so how this ulcer is caused? Mainly because of a bacterium called a Helicobacter pylori. So Helicobacter pylori is the main bacteria that is usually causing the the peptic ulcers. Other ways by which this peptic ulcer can be caused is mainly by usage, uncontrolled usage, or more usage of some antibiotics like aspirin and anti-inflammatory drug. If you take more amount of aspirin and anti-inflammatory drug, these drugs you will be able to erode the tissues present in the duodenum or in the stomach. Okay. Apart from these two important causes of your peptic ulcers, if you are able to go for a higher smoking, okay, because of the smoking, alcohol, caffeine and physiological stress, all these are also a predisposing factor for your ulcers. You should not have more amount of stress. You should avoid smoking, you should avoid alcohol, and you should try to minimize the intake of caffeine. So when you are able to do all this lifestyle activity, when you are able to correct these lifestyle activities, you may not able to get this peptic ulcer. And the final disease of your final disease of your intestinal disorder is obesity. I think you are nowadays everyone is much familiar with obesity, right? You should avoid obesity, don't be obese, like that. A lot of videos and other advertisements now it has been came. So what is meant by obesity? So it is the deposition of more amount of body fat in the adipose tissue. You may have a adipose tissue in your belly region and in your stomach region, as well as in your thigh, as well as in your arm regions and all those things. So if more amount of your fat is being get deposited in the adipose tissue, so normal amount if it is deposited, no problem. But more amount of fat is being get deposited in the adipose tissue, it results in a condition called obesity. And this, because of this obesity, how you are able to get this more amount of deposition of your fat, how you are able to get this obesity? Because of various reasons, like intake of more amount of food, lack of proper exercise, right? And the main two important factors: intake of more amount of food, improper exercise, and sometimes it may be due to genetic diseases also. You may be able to get obesity. Okay, but if you are able to have more amount of obesity, then it may even some endocrine and metabolic disorders can also be responsible for the obesity. You see here, not only genetic and excess intake of food, endocrine and metabolic disorders, hormonal disorders, as well as the metabolic disorders can also be reached to obesity. So if you have been highly obese, what will happen? It may able to produce a hypertension, high blood pressure, atherosclerosis. What is atherosclerosis? More amount of lipids will be deposited in the blood vessels. Okay, so it is called as atherosclerosis. And finally, it leads to heart disease and diabetes. Mainly hypertension, BP and diabetes they are like twins. When you are able to get hypertension, you are highly prone to get diabetes. Or if you are able to be a diabetic patient, you may also able to get highly prone to hypertension. So hypertension, diabetes, and then apart from this, you have atherosclerosis and heart diseases. So because of this obesity, these important diseases are mainly you are able to acquire. So try to avoid this accumulation of more fat in your adipose tissue. So now there is a way to identify whether you are a normal person or an obese person. Okay, there is a degree, there is a measure of obesity. Obesity has been assessed by the degree of obesity is usually assessed by a method called BMI. How much degree you are been obese? Are you normal or you are obese? If you are obese, how much degree you are obese? So all this can be assessed by using a term called as a body mass index. body mass index. What is my body mass index? So it is a how will you calculate the body mass index? It is a body weight. It is a body weight. You see here, it is calculated as body weight. For example, 50, that is divided by square of your body height in meter. So you are dividing this body weight by square of your body height in meter. For example, your body weight is 50 and your body height is 1.6 into 2. That is, you have to divide this 1.6 into 2. Okay, you may be able to get a value, and that value you are going to minus with the body weight. So you may be able to get the value called 19.5. Okay, so then what is the normal value? In which, what is the normal value? What is the value? What is the threshold value that usually been say you are normal, and what is the value if you are able to above this threshold value, then we may say obese. No, what is the value? You can see here. For example, the normal BMI, body mass index range for adult is 19 to 25. So the normal BMI for an adult is only 19 to 25. That is a normal range. Okay, if you are able to be above this 25, okay, your body BMI value is above 25, then you are been supposed to consider it as a obese person. So okay. Similarly, if you are less than your 19, it's no problem, but you have to still increase your body weight. But if you are more than 25, your BMI is more than 25, then you say you are highly obese. You have started been entering into a phase of obese. Okay, so try to avoid deposition of more fat in your body, so that this obesity can be avoided. So with this, your digestion and absorption chapter 5 has been completed. Thank you.